Hepatitis. It's a word that doesn't get as much attention as it should. We hear about HIV/AIDS, we hear about cancer, but hepatitis often flies under the radar, even though it affects millions of people worldwide. This silent epidemic, as it's often called, is a serious threat. It's a disease that attacks the liver, and it can have devastating consequences. In some cases, it can lead to liver damage, liver cancer, and even death. What makes hepatitis even more dangerous is that many people don't even know they have it. They can carry the virus for years without showing any symptoms. This means they can unknowingly spread the virus to others. We need to start talking about hepatitis more openly. We need to raise awareness about this silent killer and encourage people to get tested. Early detection is key to preventing serious complications and saving lives. Hepatitis is not just one disease, it's actually a group of viral infections that affect the liver. The most common types are hepatitis A, B, and C. Hepatitis A is usually spread through contaminated food and water. It often causes mild, flu-like symptoms, and most people recover fully. Hepatitis B and C are more serious. They are spread through infected blood and bodily fluids. Hepatitis B can be passed from mother to child during birth, through sexual contact, or by sharing needles. Hepatitis C is primarily spread through contact with infected blood, often through sharing needles. Both hepatitis B and C can cause chronic infections, meaning the virus stays in the body for a long time. Chronic hepatitis can lead to serious liver problems, including cirrhosis, which is scarring of the liver, and liver cancer. Kenya, like many other countries, faces a significant challenge with hepatitis. It is considered a high prevalence zone, particularly for hepatitis B. The reasons for this are complex, but a lack of awareness and access to healthcare are major contributing factors. Many people in Kenya don't know what hepatitis is, how it's spread, or how to protect themselves. This lack of awareness is a significant barrier to prevention. People who don't know they're at risk are less likely to take steps to protect themselves. Access to testing and treatment is another major challenge. In many parts of Kenya, healthcare facilities are limited, and people may have to travel long distances to get tested or receive treatment. This can be a significant barrier for people who live in poverty or have limited access to transportation. Section 4. Collaborative action, breaking the silence. Addressing the hepatitis epidemic in Kenya and other high-prevalence zones requires a multifaceted approach. It requires collaboration between governments, healthcare providers, and communities. One of the most important steps is to raise awareness. People need to know what hepatitis is, how it's spread, and how to protect themselves. Public health campaigns can play a vital role in disseminating this information. Increasing access to testing and treatment is also crucial. This means making testing more widely available and affordable, and ensuring that people who test positive have access to the care they need. Another important strategy is to vaccinate against hepatitis B. The hepatitis B vaccine is highly effective in preventing infection. Making the vaccine readily available, especially for children, can significantly reduce the number of new cases. Section 5. A beacon of hope, Egypt's victory. The fight against hepatitis is challenging, but it is not insurmountable. Egypt's success in combating hepatitis C provides a beacon of hope and a roadmap for other countries to follow. Egypt once had one of the highest rates of hepatitis C infection in the world. However, through a concerted effort, the country has made remarkable progress in combating the disease. Egypt's success was the result of a multi-pronged approach. The government invested heavily in making hepatitis C testing and treatment more affordable and accessible. They also launched a massive public awareness campaign to educate people about the disease. Egypt's story demonstrates that with commitment and collaboration, it is possible to turn the tide against hepatitis. Their success provides a powerful example for other countries looking to tackle this global health challenge. Section 6. Towards a future free from hepatitis. Hepatitis is a serious global health threat, but it is a threat we can overcome. By working together, we can raise awareness, increase access to testing and treatment, and ultimately eliminate viral hepatitis. Governments, healthcare providers, and communities all have a role to play. We need to continue to invest in research, develop new and innovative treatments, and ensure that those treatments are available to everyone who needs them. The fight against hepatitis is a fight for a healthier future. It's a fight for ourselves, for our children, and for generations to come. Let's work together to create a world free from the burden of this silent epidemic.